A very good evening to you all. A warm welcome to day 4 of VAIDYA SAPTAHA, Doctors Week on the occasion of National Doctors Day, organized by Saakara Cultural and Media Foundation, Dharwad. This program is streamed live on Saakara's YouTube channel every evening at 6 pm. Each evening, we have a doctor of a different specialty who will share with us their experience and expertise regarding COVID-19 pandemic. COVID has been a constant part of our lives since the last year and a half. Every day we hear news, dire news of COVID and the havoc that it is wreaking across the globe. Doctors and all other healthcare workers have been working relentlessly to ensure our safety and to restore those affected by COVID to good health. The least we can do to repay the doctors and all those who are selflessly working is to follow all the safety protocols in place and to be responsible citizens in these trying times. Coronavirus has remodeled itself and presented many variants. There have been two waves of the pandemic so far, and we are heading towards the third wave. Saakara Cultural and Media Foundation, Dharwad, chose to organize Vaidya Saptaha so as to reinforce the lessons we learnt during the previous waves so that we are well prepared and well armed with the right information to be safe during the course of this pandemic. In the last 3 days, we heard a microbiologist, a pediatrician, and a physician share their views with us. This evening, we have an ear, nose, and throat specialist who will be exclusively addressing the issues of black fungus or mucormycosis and other fungal infections which are seen during COVID. Dr. Raghunath Shanbag is a professor of ENT at SDM College of Medical Sciences and Hospital, Dharwad. He has several years of clinical and academic experience to share with us. His special fields of interest are endoscopic skull base fracture surgery, allergy, and vertigo. Welcome, sir. Thank you very much for being a part of Saakara's Vaidya Saptaha.
Thank you very much. Thank you for inviting me on this forum.
During the course of this pandemic in the last two waves, there have been fungal infections which have come to the fore. Did these fungal infections exist even before COVID, or have they exclusively come up during this pandemic period?
See, the fungal infections to the human body have been there. It's not a new thing. Even the fungus, what has become very well known among people now, mucormycosis, the black fungus, is not new. It's always been there. It's just that the number of patients who came with this particular affliction suddenly shot up to the extent that the government had to declare it as an epidemic. In fact, mucormycosis is a rare disease, a rare infection. That means it occurs once in a while in some patients. So in a year, probably I would have seen 5 to 6 cases, even in an institution like SDM hospital. But during the pandemic or whatever second wave, during the epidemic of mucormycosis, we ended up seeing not 5 to 6 in a year, but we were seeing 5 to 10 per day. So the fungus has always been there. Human body is colonized by different types of germs within minutes of birth. As we breathe air, the germs enter. Our GIT also, gastrointestinal tract also will have germs within, and skin will also have germs within no time. Similarly, this fungus, mucormycosis, the fungus mucor itself will colonize our nose within 2 to 3 days of birth. So we have it all the time with us. All these days, we used to see this fungus when it remains there without causing any harm to the host, it would be called as a commensal. It just stays with us, lives there, but doesn't harm me. Whenever the local immunity of the person goes down, that is, suppose commonly it was seen in diabetics whose diabetes went out of control to the extent that they went into what is called as a diabetes ketoacidosis. So in such a status of the diabetes, the local immunity would be so bad that a simple fungus, which is apparently harmless to a normal human being, suddenly becomes what we call as harmful or pathogenic. So this is called opportunistic infection. So it takes the opportunity of the lowered immunity of the person and then suddenly multiplies and causes a disease. This is exactly what was called as mucormycosis. It has been called as rhino-orbital or rhino-cerebral because rhino is nose. It colonizes the nose. It's always in the nose. And it multiplies and causes infection which can grow into the eye or the brain. So in some patients where the diabetes used to totally go out of control, we used to see this fungal infection in the same manner. What happened in the pandemic is the same infection came in very large numbers. So that is the difference.
What is the reason that it occupied the eye or the brain?
Yeah. See, from our birth, as I said, it colonizes the nose. It survives in the nose, and because the conditions are good for the nose, for the fungus. Only when the immunity is down, straight away it gets multiplied, and nearby structures it goes on destroying. Its primary nature is called angio-invasive. Angio means you heard of angioplasty. That is blood vessel. So invasive, it goes inside the blood vessels, the micro blood vessels in the nose, blocks it. So thereby causing necrosis. The death of those tissues which are supplied by those areas are supplied by a particular vessel. When the fungus goes and blocks those vessels, that area stops getting blood supply. It dies. That's what we call necrosis or gangrene. And in that kind of a tissue, the fungus can grow further. So it just progresses itself by killing the tissues, making dead tissue, and colonizing in that dead tissue. So it goes from the nose to behind the nose, and very close by is the orbit, the eye, and above the nose and behind the nose, deep inside is the skull base on which is the brain. So thereby it passes through, not only because a lot of nerves, cranial nerves, they come down from the brain into the neck through this skull base, which is just in and around the nose. So there are what are called foramina, small holes in the skull base for these nerves to come down. So yeah, if you imagine simple thing, the nerve for the smell, olfactory nerve, the nerve for the vision, all the nerves have to come through the skull, from the brain, through the skull, through small holes. And the fungus finds its way through these holes and also through the vessels. Thereby, it goes from the nose to the orbit to the brain.
Why has black fungus become an epidemic during this time?
Yeah. In fact, we have only few hypotheses. It is yet to be proven exactly why we got so much. The question marks are, anybody can ask this question. The first thing is the epidemic of mucormycosis has occurred only in India, whereas COVID has occurred everywhere, all over the world. So how come only in India, especially during the second wave, there was an epidemic? During the first wave also, we did see a slightly higher number of mucormycosis cases. All right. But the way we saw it during second wave was unprecedented. Nobody has ever seen mucormycosis epidemic ever in the history of medicine, anywhere in the world. So this was very unusual. Initially, everybody thought this is because of the excessive amount of steroids that are given, which are of course had to be given because they are life-saving for a patient who is in cytokine storm. Yeah. During that time, his own or her own immunity is acting against his own tissues in a confused manner, trying to kill the virus. The host immunity is acting exponentially more than required and harming the body. So to stop that inflammatory storm, that is called the cytokine storm, steroids are life-saving. They had to be given and they were given correctly. Even in the first wave, steroids were given in large amounts to save the patient. All over the world, the steroids were given in large amounts. Only in the second wave, suddenly this thing happened. So a large amount of steroids being given in a population, Indian population especially, which is very prone for what we call as a metabolic syndrome, that is diabetes, hypertension, all these things. India is called the diabetes capital of the world. So we have a large population of patients who are diabetic, but also there is probably a 10 times more larger population who don't know their diabetic status, right? Or who are borderline diabetics, who are sub-threshold, subclinical diabetics, biochemical diabetics. That is, their sugars will be somewhere around hovering there, but they consider themselves non-diabetic or would not have got tested. They would not know.
Yes.
These patients might have received large amount of steroids, which is very valid for the occasion, and thereby their sugar control would have really gone out of control and allowed the mucormycosis organism to become pathogenic. That's one. Secondly, as you have seen in the media also, they thought in terms of, the humidified oxygen that is given. For COVID, a lot of patients needed oxygen. There was shortage of oxygen. So whatever oxygen was available in the second wave, especially whatever was available was brought in and given. Was the asepsis maintained properly in all these patients? Was hygiene maintained in all these patients? We don't know. And there were queries about, industrial oxygen being used, whether that really causes. And if you know, from whenever medical oxygen is given, it is given through water or a fluid which humidifies the oxygen, because we have this nose to breathe. While we are breathing, the nose and the moistness in the nose humidifies that oxygen or the air so that our lungs receive water content, water vapor in that air that we breathe in. So if you are seen in any hospital, any ICU, there will be bubbling of the oxygen through a small container. There were doubts that this liquid that they used, ideally they should be coming through distilled water, very sterile, and it should be maintained very clean and sterile. After every day, multiple times, it should be cleaned and maintained very sterile. Because of the large number of patients all over India where oxygen had to be given in whichever way available, maybe the hygiene was not maintained, asepsis was not maintained, and that was maybe also there was a rumor that tap water was used. They did not really use sterile water and all those things. Well, these are all conjectures, because again the question mark comes: with such a high flow of oxygen, can a fungus survive in a liquid which is pumped through with a lot of oxygen? So all these are questions. Industrial oxygen, whether really it has anything to do, or is it just the steroid? Or the big question mark was whether the COVID variant that started in Maharashtra, okay, B1617.2, the Delta variant as we are calling now, this variant was not there in the first wave. This variant was not there in anywhere else in the world. It started in the second wave in our country. Does that variant have anything to do with, as an additional contributor to cause this kind of a condition which would probably allow mucormycosis to grow? So these are all different theories which are being discussed at length by all the clinicians and scientists. They are trying to find ways to at least identify what exactly happened, and if at all that knowledge can be used to prevent certain things to happen in future.
So, sir, what are the typical features of black fungus? Now, if
Hello?
a person has, hello, can you hear me?
Hello?
Can you hear me? Let us continue. What are the typical features of black fungus?
Hello?
Can you hear me, sir?
minute or so.
Can you hear me now?
Yes, I can hear you.
Yes. Very sorry for the technical
Yeah.
glitch. Let's
Yeah, that's
continue.
okay.
Yeah.
Yeah.
What are the typical features of black fungus? Now, if a person is infected,
Yes.
how is he supposed to identify that he has
Yes.
gotten it?
Yeah. Yes. Unfortunately, there is no classical, what we call as pathognomonic feature suggestive of black fungus.
Mm.
The patient may present with a simple headache, usually one-sided headache, somewhere around the on the forehead. One
Mm.
side of the face may have pain, but
Mm.
we have seen so many patients this time having a very generalized pain, or sometimes little pain they had because they saw about black fungus on TV and in the newspapers. They wanted to rule out and they came. Generally, before the COVID pandemic, when we used to see black fungus or mucormycosis cases, they used to come in usually very bad condition because the high index of suspicion was not there. Once in a while, if you see a particular disease, usually even the clinicians may neglect it. So we used to
Yes.
see them coming with, that's why the name black fungus. The
Mm.
blackening inside the nose. You can actually see necrosis
Okay.
or gangrene, as you know, the
Mm.
blackening of the inside structures of the nose, that is the turbinates. But this time, maybe because patients were aware of it, or the media did a good job of, they got scared about it and they ran to the doctors.
Yes.
Many patients came with a simple toothache, very generalized. If a patient had that toothache before, he would have totally neglected, especially during the lockdown time. He said, "Why would I go to a dentist for a toothache during this lockdown?" That kind of a thing. So one thing we should remember: all of them, almost all of them, were post-COVID. Only few questionable. I would say questionable because they didn't know they had COVID. They said we never had COVID or something like that. Okay, it's very difficult to prove those patients. We really don't know. Majority had a clear history of COVID. Of course, some of them did not undergo RT-PCR, but HRCT was done, but treated. Some of them did not know that they were given steroids because many patients are ignorant about what is a steroid, and because of the number of patients, the doctors also didn't have time to tell them that you're on steroid or something like that. So the clinical symptoms mainly is a headache or any pain in the face or head should not be neglected. Very important. Dental, any kind of swelling of the gums or toothache, even a single tooth being
Mm.
painful, you should be very much alert. You better go and get yourself tested. These are the two most important. Of course, when it becomes severe, it is very easy to detect because it all becomes black.
Black.
Third, even the slightest blurring of vision, which is usually not seen unless it's like a cataract, which is very, very, very slow. If after COVID, some patient thinks that my vision is somewhat, not good, so
Mm.
get tested. These few symptoms are very important. Keep looking inside your throat, especially the palate, as we call it, the upper jaw and behind it, behind the upper teeth. If you see any discoloration, any grayish color, not healthy pink, then you better get it tested. These are the most important tests or clinical danger sign, I would say red flag signs
Red
that a
flags. Yes.
person should approach a doctor without missing it.
When a person notices these things or suspects that he might have gotten black fungus,
Yeah.
which doctor should he consult?
Yes, that became a big problem for patients during the pandemic because, especially in the peripheries, not in the big cities,
Mm.
many doctors who were doing, single-handed clinic, they had closed. Small nursing homes, they had closed because it was difficult to handle this situation of COVID. The government had its own rules, so smaller clinics were not able to handle. Any senior doctor would not take the risk. So it was very difficult for patients to get examined. And it is true that even the doctors, including specialists, ENT or dental or anybody, even we had not seen the kind of presentation that we saw. So everybody had to learn very quickly. It was a lot of learning within no time. We had to also learn quickly to understand how this is presenting. So any patient who had these symptoms had to approach first, most important, if he has a toothache, without fail, he has to see a dentist. Okay. or he has to go to a general hospital. And actually, there were times when patients told me, "Sir, please rule out black fungus in me," that kind of a thing. So patient have to see a dentist if there is a toothache, or an ENT. Most important is a ENT, that is ear, nose, throat doctor. If there is anything related to the eye, of course, eye specialist. But it's not that only one doctor will see and he'll say, okay, you have black fungus or no black fungus. No. What we in SDM in our hospital did is a team where every patient of suspect black fungus would be seen by an ENT and a dentist and an eye specialist. All three would see, and only when all three say it's not there, then only we'll think it's not there. That too after radiological investigation. So if general public wants to know, it has to be eye specialist, ENT, dental. ENT, dental become very important. Eye specialist also when the eye is involved. What does the eye specialist do? He will examine and see if there is anything happening inside the eye, isn't it? The ENT also will look with an endoscope, because that is a hidden area inside the nose. And if the fungus is growing inside, nobody can see it outside. So the small change in the color is seen with a very good endoscope and camera. So that is the earliest you can catch. So the ENT will see inside. He or she will see whether there is a change of color or anything that appears to be suspicious. And it's not that, okay, any change of color is mucor. No, we have to prove that it is mucormycosis fungus which is invading there. So we do what is called KOH. We take a swab, a small bit of mucosa, and see it under potassium hydroxide and slide. Within half an hour or 1 hour, we are able to see under microscope whether this mucor fungus is inside the tissue and growing. And also what we do is called frozen section. That is a pathology, but done very fast. We take a small bit of tissue from the suspicious area, send it to the pathologist. The pathologist will see it under the slide and again tell us fungus is there invading inside. Because if the fungus is just there, anybody's body will have the fungus. That is where it's very important that you have a good pathologist, a good microbiologist who is able to tell you that yes, the fungus is invading inside. You have to treat this urgently. This is how an ENT becomes useful. Dentist, very important, because each and every tooth and gum has to be seen, upper jaw, lower jaw. Even the mildest of the changes which are detected by the dentist can be very, very useful. So if the public wants to know where to go, yes, eye specialist, ENT, and a dentist.
The tests that you just told, one was radiological, one was microbiology,
Yes.
and another was pathology. Other than these, are there any other tests that a person has to undergo?
I would just start it again in brief. It's not that we start with radiology. Ideally, first is clinical test. Okay, high index of suspicion. Then take microbiology comes first. Take a small swab, send it to the microbiologist, tell them to see under microscope. They will tell within half an hour whether it's there or not, because it's an emergency. Mucor is high mortality. Pathologist also, right? So we basically have to prove under microscope. That is one. After that comes radiology. Why do we need imaging? See, imaging is sometimes we don't see the color change. We don't see any suspicion. But patient has some kind of a deep-seated pain, which is very difficult to explain. So then the problem could have been happening deep inside and not visible outside to anybody, ENT or ophthal or the dentist. So that time, if you do a CT scan with contrast or an MRI, you will get to see some activity going on there. Either the bone is eroded, the bone has become, eroded means being eaten up by the fungus, or soft tissue deep inside, near the brain, below the eye, behind the sinuses, being what we call as necrotic. Means it's very simple. Mucormycosis blocks the vessels and does not allow blood to flow into the tissues. So if you give a contrast, radio contrast dye and see the image, those areas which are not receiving blood will not receive the contrast. So they will appear like hypodense. So necrotic areas can be identified. So these are the three crucial methods of detecting mucormycosis and finding out the extent of the damage.
So what is the treatment for mucormycosis?
Yeah. As soon as the diagnosis is confirmed, what we do is counsel the patient and the relatives. It's very important. It cannot be taken lightly. It is a life-threatening emergency. This is what they have to understand. Okay, we had a lot of trouble trying to explain this to the patient because it was never heard of. It's not like a heart attack which every other person knows. It's very difficult to convince them because unfortunately the cost of treatment is very high. The treatment is not a very few days treatment, quick treatment. It's a very protracted treatment causing a lot of trouble to the patient and the relatives. So what is the treatment? First, as soon as you have confirmed, immediately we have to start the patient on an antifungal drug, okay, which is given intravenously. The name of the drug is, it became famous obviously, amphotericin B. All right. So this is a broad spectrum, very effective antifungal drug. But there is a catch. We used to have this drug, which was conventional amphotericin B or amphotericin B deoxycholate. That's the molecule. It was available for about 300 rupees for 50 milligrams. And 50 milligram to 100 milligram per day would help up to 2 grams. What it does is kills the fungus by destroying the cell membrane of the fungus. Now, the problem with this drug is it is nephrotoxic, highly nephrotoxic. Means nephro means kidneys. It can damage the kidneys, not in every person, but it can damage the kidneys in a large number of patients. If you give it to 10 people, 5 of them may not tolerate it. What happens to them is their kidney functions fall, and serum creatinine is the indicator of kidney functions, as we know. So remember, these are COVID patients. They've just recovered from COVID. They have received a lot of drugs. Their health is already down. Their lungs are not good. Their nutrition is poor, and they are diabetic, either diabetic or sugars not under control. You can call it, many patients told us, sir, I'm not a diabetic. Then we told him, look, you did not know you're a diabetic, or technically you said you are not a diabetic, but right now your metabolic control is not there. So we can call it transient hyperglycemia. And it also damages the kidneys. A long-standing diabetes, of course, causes end-stage kidney disease. A lot of these patients had this problem. So amphotericin B became a major issue. And worst was it was not available. Why was there such a severe shortage? Because, as you know, before COVID, we had only few patients per year. So all over India, any institution, there will be few patients per year. And the drug manufacturer will only manufacture that many, which was usually required in the whole year. Yeah. So if you see a 1,000-fold increase in the cases, how will you manufacture? Because a drug manufacturing is not a simple process. They have to do a lot of, bring the raw material. They didn't have the raw material. Then you have to do it in a very meticulous way. So there was shortage. So to remove the kidney damaging properties of this 300 rupees amphotericin B, a new product was launched about 10 years ago. That's called liposomal amphotericin B, which is 20 times costlier than the 300 rupees. That is about 6,000 to 7,000 for 50 milligram one vial. All right. And each patient whose brain is not involved needs at least 40 vials. If brain is involved, 80 vials. Imagine 7,000 per vial, 40 vials. All right. So each of them needs at least 5 vials per day. So imagine the cost involved and the shortage. So it was a very confusing atmosphere, very distressful atmosphere. At the same time, we doctors, what we did is, we did not really wait only for the amphotericin B. Whatever we had, there are alternatives like, posaconazole. May not be very effective because protocols were different. We used whatever was available. Even without that, whatever debridement we could do. So the treatment is kill the fungus by giving the drug to run in the veins of the body, and already wherever the fungus has invaded, remove all that tissue by doing surgery. Just cut it. Basically, just cut it away from the body, remove that tissue, what we call as debridement. If the jaw is involved, we have to remove the jaw. Okay. If the nasal sinuses were involved, we have to remove all that tissue. If the eye was involved, we had to remove the eyeball completely. So there were times when we had to remove from the skull base. There were abscesses in the brain we had to drain. So it was a very distressful thing. So the principle of treatment is let the antifungal drug run in the veins and remove all that tissue which is already affected by the fungus, devoid the body of the fungus. This is the basic line of treatment.
during this black fungus, the whole epidemic, there were also other colored fungus which came into the picture,
Yeah,
and they were also given a
yeah,
lot of undue attention,
yeah,
and
yeah,
they also
absolutely.
created a
That's right.
kind of panic. So, what
Yes,
are
yes.
these other colored fungus, and are they, how
Yeah,
dangerous are
yeah.
they?
Yeah. This is a little bit of the flip side of the media. But actually, regarding COVID or the oxygen shortage or anything, media has a habit of making it big to catch the eyeballs, to catch the attention. But I'm really thankful, for that ferocious way of media talking about mucormycosis. People really came. Otherwise, imagine in our country, even if they are scared, the kind of carelessness people have showed towards social distancing, mask and all is tremendous all over the world, I would say. So anyway, I would like to start like this. The color of the fungus is the question, right?
Yeah.
So-called black fungus, mucormycosis, is not black fungus. All right. For general usage, because mucormycosis is a tongue twister, literally for non-medical people, so they didn't have to worry about it. So the black fungus doesn't matter. But the fungus per se is not black, because it blocks the vessel and causes necrosis or tissue death, thereby causing blackening. So you can call it black fungus. Understood? That is fine. Regarding white and yellow fungus, it was there was nothing in that. Okay, white fungus. I mean, you can say Candida is. You can say it causes white, dirty white, or curdy white precipitates. Yellow fungus you can call Aspergillus flavus, what we see here and there, Mycosis and all that, yellow fungus, but they were not there. They were not the cause for the problem. Of course, Candida can occur in patients of, say, HIV or any immunocompromised patients. Candida can become harmful. Aspergillus can also become harmful. But definitely in this season, we did not have that kind of, variety of colored fungus coming there. So that is out of question. We have to concentrate on what we have in front of us, zygomycosis or mucormycosis. Yeah.
How can a person avoid getting black fungus infection?
Yeah. Yeah. Very true. Number one, whether you had COVID or not, every person, I'm just giving this message. First thing, take care of your hygiene, cleanliness, wash your hands or wash your face, soap, water, whatever that is you have to do. Avoid, wearing the same mask which has become moistened or dirty or has drenched in the rain or sweaty. Do not reuse the mask. It's not worth it. Okay, number one. Number two, keep checking your health parameters. That is, especially blood sugar. Okay, there have been hardly cases where, whether COVID, non-COVID, steroid, not most of the mucormycosis patient who came to us had their sugars out of control. Very simple. All right. So let's shortlist it. What is the parameter which was wrong in most of them? Blood sugar. So if your blood sugars are normal, because see, how come mucormycosis did not occur in every patient who was given blood sugar, high steroids? Simply because, like in our hospital, in many of the hospitals, in SDM also, every patient who was given steroid, whether it was orally in the form of tablets or injection, was regularly monitored for blood sugar and all the other parameters. Especially in the ICU, when they were receiving lots of ventilation, ventilator, oxygen, or NIV, whatever that is, they were all put on insulin. Okay, on a sliding scale. Anybody's sugar going up would be given insulin to keep the sugars under control. No matter what, sugars were kept under control. That's why I'm happy to say we received a lot of patients of mucormycosis from outside. I'm not saying they are this and all, but very few, if at all, those patients who were being treated in our hospital for COVID ended up with mucormycosis. That is what we are trying to say. That is how. I'm not saying others did not do it. The situation was very different in many places. Even general physician, doctor, general doctor, whoever was available had to give whatever medicine he knew. So also ignorance of the people. So what I'm trying to say, if any patient wants to know, how do I protect myself from mucormycosis? If he asks me, doctor, you tell me one thing which I should do, I would say maintain your hygiene, check your sugars. That's it. These two things will definitely keep you. And of course, even if you have red flag signs or not, just get one ENT, eye, and dental checkup done after your COVID treatment. I'm not saying you should rush to the doctor. You don't have to rush to the doctor. Just get a checking done. You don't have to go and tell the doctor, please see if I have black fungus. No, just get it done. That's more than enough, because many patients did not really have the kind of aggressive black fungus that we saw. Some of them had months together, gum swelling, months together. They developed what we call as osteomyelitis of the maxilla with mucor. It was not suddenly spreading inside into the eyeball, but they had. The bone was eaten away. Only few teeth would fall off, you know. And if they neglected it, if they came after 2 weeks, I saw all the teeth had to be removed. And the jaw, entire jaw, not just the teeth. So it's better you get a dental checkup done. Just let the dentist see everything. Let ENT see everything. That would be fine.
Does a vaccinated patient, is he protected from mucormycosis?
Okay, the vaccine against COVID definitely protects the person against the severe morbidity of the COVID. That's what we have noticed. Hardly any person who is vaccinated, completed his vaccination, has had a very bad COVID and death. So that is one thing. It's a rare thing to have happened. Who have been vaccinated completely and then developed COVID and died. So this is what we noticed with the thereby, because you are protected from severe COVID where steroid is required, you will not be given steroids. Even if you are turned positive, your symptoms will be less, and hopefully you will not need steroids. And so thereby you are prevented from having any of the complications of COVID, including mucormycosis. Isn't it? So that's how it is. COVID vaccine per se has nothing to do with mucormycosis, but because mucormycosis occurs in those patients who had severe COVID and steroids, thereby you can say yes, but vaccination is a must.
Yes. Thank you, sir, for spending
Thank
your
you.
valuable time with us and giving
Yes, yes.
us so much valuable information about black fungus. Armed
Thank
with
you.
this kind of information, it will be, I won't say easy, but it will be a little,
Yes.
um,
Helpful.
we
Yeah.
might be able to face it with a lot more courage than courage and more education than we had before.
Absolutely. Yes.
My last question to you is, what is your message to our viewers and the general public about this pandemic?
Yeah. Of course. About the pandemic, this is life changing. COVID means a lot of different things to different people. People lost their life. People lost livelihood. Some people, their business improved, like internet based businesses, they all improved. So COVID means different things to different people. I'm not the one person to give the sole message. People have learned a lot already. But as far as mucormycosis is concerned, I can tell only one thing, which was not very much highlighted in all the media or even the government resources. Blood sugar, that was not highlighted somehow. They kept talking about the steroids or the mucor or black fungus or the oxygen, industrial oxygen. All these things were told. But if the person says, how do I protect myself, whether I've had COVID or not, just see that your sugars are normal. Just see that your dental treatment is there, any hygiene is maintained, nose and eyes are well under proper, healthy control. That's more than enough. As far as mucormycosis, I would like to say the same thing. Whether the third wave comes or not, whether the third wave is severe or not, let us not get again worried, because a lot of people are worried. Suppose, people have seen their own friends lose their eye, jaw, and dying of mucormycosis. So they're all petrified, literally, the family members and all. I've had patients, relative come who had come to see the mucor patient. They come and say, "See, I have a black patch here. Is this black fungus?" They're not wrong, but imagine the kind of stress they go through when they see something happening there and they don't know what it is, and they think that it is black fungus, and they get worried. And of course, they get a lot of wrong information also. Some casual person will say, no, this is black fungus, you apply this, you cut this, and all kinds of things. Don't do that. First, you see your parameters. If your parameters which say that your immunity is good, unlikely you will have black fungus or anything for that matter.
Thank you very much, sir.
Thank you.
Dr. Shanbag spoke very beautifully and very clearly about black fungus, its complications, why it happens, what we can do to avoid it, And he said we have to maintain our healthy lifestyle, be active, and not panic in a situation where we might suspect that we may have black fungus, and to consult a dentist, an ENT specialist, and an ophthalmologist to rule out the possibility of us having black fungus. He also mentioned that blood sugars being under control is one of the most important parameters to make sure that we are not susceptible to black fungus. Tomorrow evening at 6 p.m., we have Dr. K.S. Pavitra, a renowned psychiatrist from Shimoga. She will be speaking to us about mental health issues which have arisen during the pandemic, and also about how efficiently we can tackle them and keep ourselves physically, mentally healthy. We will see you tomorrow evening at 6 p.m. Until then, good evening.